Hello everyone, welcome to TTV. Today I have a very interesting guest joining in for the show and who's going to tell us about how to take care of your skin. So let's welcome Dr. Heba Moftah, a dermatologist from Agecare Clinic. Thank you so much, Doctor, for joining us today.
Welcome, thank you.
So Doctor, I'm sure there would be a lot of questions that people ask you about how to take care of the skin during Ramadan. Do you think that fasting actually caused some kind of dullness to your skin?
Okay, first of all, Ramadan Kareem.
Ramadan Kareem to you
Ramadan
too.
Kareem. Then when we mention fasting, some people think that because of dehydration, that may affect my skin or make my skin dull. But actually, on the other hand, the fasting will arise immunity and put our body in the anti-inflammatory state, and we will get rid of all toxins and waste in our body, so we will be more glowy with fasting. And as it acts as anti-inflammatory, so some anti-inflammatory skin diseases like acne or psoriasis may improve.
Right, so doctor, these are the advantages of fasting, you're saying.
Yeah.
But there must be people, who might actually have dry skin, so this might cause extra dullness.
Yes.
So how do they take care of their skin while they're fasting during Ramadan?
Okay, we can use moisturizer which is suitable for our skin type, like several times per day, and don't forget our neck and the décolleté area and our hands also. Moisturizer for our lips is very important. Try to get enough water between iftar and the suhoor, like 3 liters of water. Using of serum which is rich in vitamins, like this serum which is rich in antioxidants or hyaluronic acid will help us. Also the sessions will help us, like mesotherapy or PRP. And I want to say for people something, because this is frequent question for us: is this session may interrupt our fasting or not? Actually, yes, it's multivitamins, but we inject it in skin. It doesn't enter our bloodstream. So when we ask Sheikh, he
Yes.
informed us that no, it won't interrupt our fasting, so we can do.
Okay, doctor, you just mentioned about PRP and mesotherapy. What exactly is the difference between the two, and what exactly does it do?
Okay, mesotherapy, it's like multivitamins which we can use to treat different complications of skin. Like if I have pigmentation, I can use some whitening multivitamins like vitamin C, tranexamic acid. If I have dull skin, I can use hyaluronic acid. If I just need to rejuvenate my skin, I can use something like anti-aging vitamins. So we can do it for several complications. About PRP, it's the platelet-rich plasma. It's from our own blood, but by a special technique we can get the platelet-rich plasma, which is very rich in growth factors, so it will nourish our skin and slow down the aging process.
Right, and how painful are these both procedures?
Okay, actually about the pain, we will put topical anesthesia for 20 or 30 minutes, so no pain actually. All people can
They can tolerate it,
yeah.
Because I know, doctor, I actually had a PRP session due to
Yeah.
because of the pigmentation, like you
Yes.
said, and the color of the skin wasn't even. So the doctor suggested PRP, and I remember that there was an anesthesia cream that was put
Yes.
on my face, and it was absolutely painless.
Yeah.
So that was about skin, Dr. Heba. Now comes to the hair. You know that hair also needs the same kind of protein and vitamins and of course nutritions. Now how do you take care of hair during Ramadan, especially when you're fasting?
Okay, about our hair, it will affect by malnutrition. Like if I take food which is poor in iron or poor in vitamins and minerals, yes, this will affect our hair. If I experience any hair falling, I have first to do investigation to exclude iron deficiency anemia or deficiency in vitamin D serum or deficiency in serum ferritin. If I have one of these problems, I have to take multivitamins and the medication. If there is no problem about my investigation, I have to start to treat my scalp by mesotherapy also and PRP, but specific vitamins for hair, and topical sprays which sometimes rich in multivitamins, sometimes rich in minoxidil.
Right. Doctor, you just mentioned about multivitamins. Is this something that you need to see a doctor to look for multivitamins, or you can just get it off the counter in any pharmacy?
Actually, no, because the multivitamins for hair is specific for hair and nail and the skin. So we have to ask one specialist in dermatology. So he will advise us about the suitable type of multivitamins.
Right, right. Now, doctor, you know, this was Ramadan, and of course, Eid is going to be after Ramadan too.
Yes.
And considering the COVID-19 situation right now that we have in the Sultanate, there is going to be a lockdown starting from 9 p.m. until 4 a.m. And of course, people would still, even though they're celebrating Eid at home,
Yes.
they would still want to look, you know, pretty and, you know,
Yes.
take pictures and have Zoom calls with families. So for that kind of occasion, if one has to get ready, where should they start from?
Okay, first we have to consult a specialist, so he will put for us like a plan of treatment. We have to start as soon as possible, because sometimes if I have wrinkles and I need to do Botox, it will take like 2 weeks to get the result. After that, I may need to do a retouch. This will also take 2 weeks more to get the result. If I have grooves and I will need to do filler, it will be the same. It will take 2 weeks to give me the end result. If I have pigmentation and I will do peeling, I need to wait at least 3 weeks to get the result. Even for our glowing or rejuvenation, I will need to do more than one session, like sometimes combination of treatment like Profilo, Skin Booster, Vivace and PRP. So if I need to be pretty naked, I have to start from the beginning of Ramadan to work on my skin.
So you're advising that people should start from the first week of Ramadan rather than waiting
Yes.
towards the mid of
Yes.
Ramadan.
And actually some of this session may cause some swelling or bruises, so no need to do it immediately after, before I eat.
Right, right. It same goes with the facial, right, doctor?
Yes.
Like when people say like if you want to get a good result, you actually should do it like 1 week or 10
Yes.
days before getting the
Yes,
results.
sure.
Dr. Heba, you mentioned about Profilo too. What exactly is Profilo? I'm sorry, the terminologies
No,
are
it's
so
okay.
new, so I really want to know what exactly we're talking about.
Okay. Profilo is hyaluronic acid, but it's different from filler. It doesn't cause any volume. It causes only deep hydration of our skin. It enhances collagen and elastin, so we will become glowy. It's also act as anti-aging course, which slow down the aging process. If I am like 30 years old, I have to start Profilo from this age. If I am between 30 and 40, 2 sessions is enough. Then I will repeat it every 6 months. If I am after 40, I have to do like 1 session per month for 3 months, then repeat it every 6 months.
Right, right. And what is Dr. Vivace? What exactly is that?
Vivace is microneedling technique with radio frequency. It also enhances our collagen and elastin. Actually, it's perfect in treatment of acne scars and wide pores. It gives us a lot of rejuvenation. Sometimes we do it alone, sometimes we do it in combination with BRP and the vitamins, and it really improves the skin tone and the fine lines. It really amazing session.
So it's called Vivace.
Yes.
Okay, I thought it was Vivace something.
No, it's okay.
Doctor, now talking about, you covered, mashallah, everything, from skin to hair to everything. Now talking about skin boosters.
Yes.
What exactly are skin boosters?
Skin boosters, it's hyaluronic acid, which we inject it intradermal. It causes deep hydration of our skin, and some of them is combined with multivitamins. So it also gives us glowing effect and rejuvenation and improve our skin tone.
Okay, Dr. Heba, you mentioned earlier about the procedure of filler and Botox. What are the side effects, if there are any side effects, if you're taking these 2 treatments?
Filler and Botox have been discovered now for a long time, and a lot of people actually do them, but still some people are afraid that they may have some side effects. If I choose good quality of the product and the procedure itself is correct, no side effects except maybe some bruises or swelling, and this is normal after any injection. It will take like 1 or 2 days and it will subside totally, so no need to fear. Sometimes some people fear that maybe after injection of filler and it will go, that I will get sagging of my face or something like this. Actually, no, it doesn't happen at all. Filler will help us if I have dark hair talus or tear trough, if I have grooves like this one, nasolabial fold, even in my hand, if I have grooves or my hand looks old, يعني it has a lot of uses. So يعني no need to be afraid from this procedure.
Just because it has a lot of needles, you shouldn't be afraid.
Yes.
But Dr. Heba, do you need to retouch these fillers or Botox after a certain time period, or it's a long-term thing?
Yes, we need to retouch. يعني we need to retouch. يعني if I will do filler, it's according to the place and the type I will inject. يعني if under eye, yes, it may last like 10 months or 1 year. On my cheeks also it may last like 1 year, but according to the lips, because it's movable, so it will be only like 4 months. In the nasolabial fold, actually it will last like 10 months. So yes, it will take time, but after few months I will need to do retouch. About Botox also, it will last like from 4 months to 6 months according to my response and my age, and I will need to retouch again.
Right. Dr. Heba, if somebody wants to get in touch with you at the clinic, what are your available hours or available days so that people can come and ask for consultation?
Actually, we are available in Agecare clinic every day from Saturday to Thursday except Friday, from 10 a.m. to 8 p.m. except the time for iftar. And now we have offered in our clinic that in all Ramadan we have free consultation. So if anyone want to come to ask something about skin and hair, it's completely free, and they can follow us on our Instagram page, because there is, in the first week of Ramadan, there is like competition and there is free session for the one who will win, inshallah.
Oh, that's amazing.
Yeah.
But one last advice that you would like to share with our viewers.
I want to advise all people that they have to know that our skin is the largest organ in our body, and actually it will represent us for a long time. So we have to take care and invest in our skin. Please to seek advice of dermatologist from one time to other, like every few months, because he will advise us according to our age group and our what the skin need. And we have to take care of our daily routine care, which is suitable for our skin. And please don't apply any cream that which is suitable for our friend, because it may be not suitable for us. Don't take any medication without advice of dermatologist.
Thank you so much, Dr. Heba, for being here and sharing such amazing information about skin and about how to take care of the skin and the hair, especially during Ramadan while everybody is fasting. And it was a lovely conversation with you.
Welcome. I was happy to be with you. Thank you.
Likewise. Thank you so much, Dr. Heba. I hope you all took a great note of the advices that Dr. Heba shared with you today. For more interesting videos, keep watching TTV.